Hello, my name is Bienvenu, and today we're going to talk about signs and symptoms of hypo and hyperglycemia. So we're going to start with hypoglycemia. Hypoglycemia is basically low blood glucose. Um, it could be not enough food, or too much insulin, or diabetes medication, or extra activity, which results in low blood glucose. The onset could be sudden and may progress to insulin shock. The patient may be shaky, tachycardia, diaphoretic, feeling dizzy, anxious, polyphagia, impaired vision, feeling weakness, constant headache, or very irritable. There's a little thing I try to remember this by in the hospital. If I see my patients cold and clammy, need some candy. So if your patient is diaphoretic and clammy and just feeling real irritable, definitely check their blood excuse me, tongue twister, blood glucose. They may just need a simple fix is some glucose. You may want to give them just a sweet peppermint or a candy, eat it and see if it comes up. If it does come up, then we need to give them a complex carbohydrate, which basically would hold the patient over longer because that takes a longer amount of time to break the carbohydrates down, which would extend the blood glucose and higher for a longer amount of time. Next one we're going to talk about is hyperglycemia. Hyperglycemia could result from too much food, not enough insulin, or any other diabetic medications with a PO, or IV, whatever medication is just too little. Illness or stress in the body can increase your blood glucose. This onset may be gradual, and if it gets high enough, it could progress to a diabetic coma or DKA, which is diabetic ketoacidosis. The symptoms for hyperglycemia is polydipsia, polyuria, dry skin, hunger, increased hunger, so blurred vision, drowsiness, and feeling drowsy. Excuse me, I said that one a second ago. Uh, with this one here, decreased healing as well. That's a problem diabetics run into. Their wounds doesn't heal as fast, so there's possible increased risk for infections and things like that. Make sure you educate your patients to test their blood glucose, whatever the physician require or has prescribed them. To educate them that it's very important. It's not just a hassle. That your blood glucose is very important in your daily life. It can cause a lot of complications if it's not managed properly. Um, Educate these patients, even though I use medical terminology for this purpose of this video, educate your patients on lay terms. They may not know what tachycardia means. So when you're just teaching them about hypoglycemia, they may not know what tachycardia means. Say fast heart rate or diaphoretic, just say sweating. Definitely teach your patients to just all the signs and symptoms in lay term because they're not going to tell you that they don't understand or they don't know a word because they don't want to seem less educated than you are, and they're just going to shake their head and say yes, but they have no idea what you're talking about. So remember that, and that is everything for hypo and hyperglycemia. Thanks for watching. Thank you.